to go. All right. I'm here at PharmaSafe today with Mike Rath, and we're talking about seasonal allergies. So, Mike, seasonal allergies are pretty big at this time of year. Is there something you can tell us, some tips, some tricks, how to keep those seasonal allergies under control?
Sure. I mean, there's a few things that a person can do. First off, I mean, typical signs and symptoms of seasonal allergies will be, might have some sneezing, you might have some congestion in the nasal sinuses. Itchy, watery eyes would be, where you're having it in both eyes is a good sign that there's an allergy component to what's happening. And definitely with everything blooming this time of year, that's sort of when everything flares up. So we get a lot of questions about it. And there are some really good products that are really safe to take, that are nice, clean drugs in the sense that there's very few interactions you have to worry about with other medications and very few side effects really with them. And typically if somebody's just experiencing your typical sort of hay fever symptoms that I described there, I would recommend either one of the three products, Reactin, Arius, or Claritin. They're considered a newer generation antihistamine. An antihistamine is a fancy word for an allergy product, okay? And the nice thing with them is they're just a once-a-day, non-drowsy product that you can take every day just to keep things under control, because it helps treat the cause of the symptoms rather than just treating the symptoms. And if you can get the cause under control, then the symptoms will clear up. Now, if somebody's already in a full-bore flare-up of their allergies, it might take a few days of taking something like that to sort of get it back under control. And so typically we recommend if somebody's experiencing allergies on a regular basis, every season like clockwork, and they know that it's gonna flare up, we actually recommend start taking them a couple weeks before the season starts coming into full effect and preventing your allergies from breaking out to begin with.
So then your typical allergy season, would that be around like the time in we're right now, April, May, that time of area?
Yeah, it even started, a few weeks back. Even as soon as the snow is starting to melt, the first things that people might be allergic to is just even some of the snow mold that's around. That's the first wave of what we see people coming in for. And again, the same products would be just as effective for that. And then, comes everything, grass starts getting green, things start being in bloom, and then you see more and more people coming in with problems.
So what about for children? How do you know if a child's suffering from allergies? Is that something that, they can be treated the same way? Or what would you do for a child that may be suffering from allergies?
Yeah, well, first thing, if they're under 2 years old, you definitely come in, feel free, ask us questions, and we can sort of make an assessment. But it's probably a good idea if you have a child under 2 years old who's experiencing some of those symptoms, it's not a bad idea to have them talk to the doctor. And there isn't a lot over the counter that we would recommend for under a 2-year-old until maybe you talk to a physician. But from kids, even say from 2 years old and up, there are some options. There's some liquid options. There's a liquid form of Arius for kids. There's a liquid form of Claritin for kids, and they are, again, safe to use. There are older products available too, like Benadryl and chlortriptan that people have heard about, and they will work, but the problem with them is they cause drowsiness. And I'm speaking for both kids and adults. They will cause drowsiness, and they only last 4 to 6 hours. So you're constantly having to take something all day, and you're potentially getting drowsy from them. For allergic type reactions, where say you get a wasp bite and your legs swelling up or your lips are swelling up, that's sort of the place for Benadryl. But yeah, for kids, there are still some options.
Now, what about nasal sprays? Some people use them for allergies. What would your opinion be on nasal sprays? Yeah,
well, it really depends on the type of nasal spray. So up until recently, the older nasal sprays that were available to buy over the counter were things like Dristan, Otrivin. People are very familiar with those names. They're names that have been around a lot, and we typically don't recommend them for controlling your allergies. They're just a straight decongestant, which means they're just going to get rid of that feeling of the stuffiness in your nose, but they're not really treating the cause. So, they might not help at all if you have some sneezing or if you have watery eyes. And the other thing is, if you tend to overuse them, if you're using them for 4 or 5 days a week, any longer than that, your nose actually sort of starts to become dependent on them, and you actually start getting what's called rebound congestion from overusing them. So we typically try to push people away from using that kind of product. On the flip side, now there are some nasal sprays that are available that have just recently become available over the counter. They were only available by prescription before that you can get, and they are safe to use on a daily basis and are quite effective. It's a steroid inhaler, so a Nasacort here is something that you can get now that you can use on a regular basis. So than other things, it might help with the eyes a little bit, but if
people might be able to do other than taking medication to perhaps reduce the reaction they may get to some seasonal allergies?
Yeah, I mean, avoidance, right? But this time of year, it's really hard to avoid it. So, I mean, I guess it depends on the severity of your allergy. So, I mean, if you could avoid the allergen, that's going to be your best bet. If you're looking for things that aren't so much of a drug, you can do, like, say, a saline rinse. It's essentially salt water, and we have packets and devices for that if you wanted. And that way you're not taking a drug so much. And even for eyes, sometimes just getting a teardrop that doesn't necessarily have a drug in it, just to help flush the eyes, will help. It might be better than nothing. So if you're really not one who wants to be taking a pill every day, I guess those are some minor options, but it's something.
And I mean, I guess with women who may be pregnant or breastfeeding, are these drugs something they could potentially take, or would that be something that might not be allowed during the pregnancy or breastfeeding?
I think you'd want to. I would recommend that they come in and talk to us, because it might sort of depend too on, like, how severe are we talking about? Is it something that maybe, like I said, doing even a saline rinse and flushing the eyes with some drops is good enough just to get you over a bad patch, rather than, like to try to avoid taking medications even if they are considered safe. There are some safe options, but at the same time, it's always good to come in, have that conversation. I wouldn't want to just say, you're pregnant, just go ahead and take something, because it might depend on the trimester that they're in and whatnot. So definitely, we're always here to answer those questions, those tough questions, and we always happy to refer to the doctor too if we think that there's something else of concern that we can't take care of. So
sounds good. Well, I don't think we have any other questions. Is there anything you'd like to add?
No, other than feel free to pop in. We're always here to answer these types of questions, whether it's allergy medications or cough and cold or pain relief, and hope to see everybody in here.